Okay, now for part 3 of circulation, let's talk a little bit about blood pressure. So blood pressure is defined as the force of blood in the blood vessels. When we say force, that means how much, I hesitate to say pressure, but how much outward push. So let's say if you're looking at a cross section of a blood vessel, it's how much the blood pushes on the interior of the vessel as the blood is flowing. All right, so if you think about your blood vessels as a hose, it's like the amount of water going through the hose. Blood pressure is the highest in the arteries and lowest in the veins. And so this gradient, we call it a gradient, causes blood to circulate from the heart to the aorta to superior and inferior circulation. You have to have enough blood pressure to get, to allow blood to fight the force of gravity to go up to your head. But that blood pressure allows the blood to flow from an area of high pressure to lower. And believe it or not, even as blood is going up against the flow of gravity, the pressure is lower in your head because the heart is generating a high pressure. So this picture is demonstrating systolic and diastolic pressure. Remember, diastolic pressure in the ventricles is when the ventricle relaxes. Systolic is when the ventricle contracts. So when the left ventricle contracts and ejects blood out into the system, we get up to normally 100 millimeters of mercury. Hg is the chemical symbol for mercury. Why do we use that? It's because that's what the physicists and chemists decided to use to measure pressure. That's all you need to know about that right now. But millimeters of mercury is basically if you had a column like a thermometer and you filled it with mercury and you had an open-ended column and it's designed a certain way. The level of mercury goes up or down based on how heavy the air is. Okay, so that's how we measure air pressure out in the environment. We measure blood pressure in a similar way. It's all calibrated to millimeters of mercury. Get rid of that real quick. Ooh, where's my eraser? Holy cannoli. There we go. Alrighty, so moving on here, get our pen back again. So systolic and diastolic normal blood pressure is 120 over 80. There have been modifications recently, but we'll stick to 120 over 80 for now. The average is 85 millimeters of mercury. As we proceed from the aorta to large arteries, small arteries, and arterioles, right before the capillaries, blood pressure drops significantly from 85 average to 35 millimeters of mercury average. Why is that important? Well, remember, capillaries are only endothelial cells. If we had super high blood pressure, the capillaries would burst, right? So this drop in blood pressure is appropriate to get blood out to the capillary beds in your head and in your body. But then pressure is low enough so that you basically don't burst blood vessels. Now, in individuals that have super high blood pressure, they can end up with things called spider veins. That's where they're not actually veins. They're burst capillary beds. You'll see this in individuals, sometimes in people who have blood vessels burst in their nose. They look like little red spider webs on their nose. That is also can be related to high blood pressure. As blood proceeds through capillary beds, and gas exchange occurs, pressure lowers to 15 millimeters of mercury, small veins 6 millimeters, large veins 2 millimeters. And by the time we get to the vena cava, right, by the time we're returning to the right atrium, this is both superior and inferior, blood is at 1 millimeter of mercury. It's like virtually gone. The pressure's gone. So those one-way valves keeping blood going in one direction is super important. So blood pressure is generated by blood volume, how much blood you have. It includes hydration levels, heartbeat, how fast your heart's beating, blood viscosity, which is a main factor, which is mainly affected by protein levels and water again. These are the main factors that produce blood pressure. Okay, remember viscosity means thickness, all right? Blood pressure is going to definitely vary from time to time throughout the day. Your blood pressure will be low when you wake up in the morning, and it peaks at about 1 or 2 in the afternoon. Now, venous return to the heart depends on 5 things. Of course, a strongly beating heart to get the blood out to the capillary beds. an adequate arterial blood pressure, right? Oops, I didn't mean to do that one yet. In other words, your arteries need to be able to maintain blood pressure at a constant level so that blood can get into capillary beds. Intact valves or healthy valves in veins. Pumping action of skeletal muscles. What is that? We'll talk about that in a minute as muscles contract. And then changing pressures in the chest cavity caused by breathing. Believe it or not, as you breathe in and out, that helps pump air back into the vena, from the vena cava back into the heart. So let's look at, just briefly, this picture showing arteries bringing blood out to the body. In our muscles, there are, and we'll see probably a picture of this in a minute, there are deep, deep veins and arteries in the muscles. Remember I told you not to focus on the deep femoral vein or deep femoral arteries? Well, the deep arteries and veins, let's talk about veins, will be bringing blood back up to the heart. And we'll talk about that in a minute. So the pulse, let's talk about pulse first because that's going to affect our blood return. The definition of a pulse is the expansion and recoil of blood vessels in the walls of, in the blood vessel wall. And so there are a few places in your body that you can count the pulse easily on the carotid. You can do it on the facial artery if you have a very superficial facial artery. We typically count the pulse on the radial artery right here next to your thumb, right, on your wrist. Pulse can also be counted on the femoral artery, behind your knee, on the popliteal. Or in babies, they'll oftentimes do the dorsalis pedis, the small blood vessels over here, because babies can be really sensitive when you touch them. And so it can be hard to get their pulse rate from their little wrist. They'll pull their hand away, but you can get their pulse rate from their toes and their foot. In terms of blood coming back, I'm going to go back a few slides here. I do want to show you one thing. When blood is returning up to the body, all right, up to the vena cava, these veins, these one-way veins, are deeply embedded in tissues. So this would be the deep femoral vein. And so what happens is that this vein is embedded in the semimembranosus, semitendinosus, among all those muscles. And so as you walk, the contraction of the muscles puts pressure on veins. As that pressure happens, that acts as a pump to push blood up to the next compartment. So it pushes blood up through this semilunar valve. So blood can be pumped up through numerous valves, through numerous compartments, simply by moving a little bit. So I did want to highlight that. Let's go back now. We did blood pressure, pulse. Let's just talk briefly about failures of circulation. Circulatory shock is where circulation stops, right? And we fail to deliver oxygen to tissues. That actually causes problems. The quickest would be to the brain tissue, and that causes an individual to basically pass out. Circulatory shock can be classified by different, they call them schemes, but by different purposes. Cardiogenic shock is caused by heart failure. The heart stops pumping. That means you stop, the circulatory system stops delivering oxygen to tissues because there is no circulation. Hypovolemic shock is a little different because this is due to a loss in blood pressure. Blood pressure drops really quickly. This can happen if somebody stands up really quickly and they get dizzy. That's an adjustment that the body makes, the autonomic nervous system. When you stand up really quickly, the autonomic nervous system tells your blood vessels, your arteries, oh, clamp down a little bit to maintain blood pressure. Well, sometimes you stand up faster than that can happen, and that drop in blood pressure makes you dizzy. Neurogenic shock happens when you have a dilation of blood vessels. The dilation, remember, dilation is opening up. It reduces blood flow, and it happens because reflexes in nerve conduction are not being regulated properly. Neurogenic shock can happen for a lot of reasons. We don't need to go into that right now. Anaphylactic shock, this is nasty. This happens when somebody has a severe allergic reaction to something like a bee sting. And what that does is it causes blood vessel dilation again. It causes them to shut down. And what the body's trying to do is protect itself from getting this poison out, but at the same time, it's suffocating itself. It's a really severe reaction to something from the environment. Septic shock comes from something called septicemia. This is where blood toxins, usually as a consequence of infection, so a bacteria is making a toxin, or the bacteria themselves are toxic to the body. This leads to a drop in blood pressure again, and again, it complicates circulation. So that's it for blood pressure and circulatory illnesses. We'll catch you on the next lecture.